Got the trachea, it goes into the bronchi, and then it goes, you know, into these tiny little, like this, right? So it breaks off until it's really tiny at the capillary level. So,
the alveoli.
yeah, so at that capillary level down here, you've got alveoli that kind of look like this. And then you've got your capillaries, which is the end of blood vessels, right? It's that tiny little microscopic level where there's gas exchange. So you got the O2 that you breathe in from the lungs, it goes into the blood vessels, and then you're breathing out the CO2. It's not necessarily like a one-to-one. It's not like, you know, one O2 molecule and one CO2 compound going out. It's not quite one-to-one, but that's basically kind of the direction that each of them go. So just say here you have a capillary that's passing under here. So this is, got a red pen out.
Somebody has 3 colors, don't you?
Yeah, right. So that's your blood vessel down here. So this is where the gas exchange is happening, right here. So depending on how permeable, what does permeable mean?
Holes.
Penetrating.
Yeah. Depending how permeable this is how much gets in here, and how much gets out here, right?
There's a gap, or it's literally through, that's, there's no, like a synapse space. No, it is.
It's not a synapse. It's
I know it's not a synapse. I'm just using the word synapse.
it's kind of like it's a barrier, and you need different things to transport molecules across.
Okay.
So depending on how big or how small the molecule is whether or not it's likely to go into the alveoli. So you got, like, you know, these tiny little molecules down here that are more likely to go in, whereas things like proteins and different molecules that are bigger, they're not as likely to escape into that area. So that is normal gas exchange. So what happens is when you get something like a ARDS, that's when things start going wrong. So I'll let you guys keep this out here. So somebody want to hold that down so you guys can see it. So there's like 6 different phases with ARDS.
Sit on it.
The first phase is kind of when there's like a little bit of an inflammatory response. So this is what you call your asymptomatic phase. So you're not going to see anything, you're not really going to hear anything yet, but just know that there is starting to be some inflammatory responses that are going on. So different markers are being released, things like histamine, bradykinin, serotonin. Those are all being released here in this blood vessel, and those are sending signals. Anytime these kind of markers are being released, they're sending different kinds of signals here. So what's happening here that causes this is any sort of decreased blood flow to the lungs. You get these platelet aggregations that go on, you know, when platelets kind of sense some sort of either trauma or something, platelets start to kind of stick together and make these platelet plugs, right? So that happens, you get these histamine, serotonin, and bradykinin releases here. So all that is going to start sending signals to inflame more, and it's going to start to damage this membrane here. As this is damaged, what that means is it's becoming more permeable than it should. It means that more stuff is getting across than it should originally in a healthy body
Because
be
of the
allowed.
inflammation?
Right. So fluid starts to shift out of the blood. This is your river here. It starts to shift out into the interstitial space, which is that tiny area in between, and it kind of starts to fill up the alveoli here. And remember, you've got millions of these alveoli all throughout your lung spaces here. So the fluid shifts into the interstitial spaces and then eventually into the lungs. And now you're into phase 3, where you get even more capillary.
What was phase 2?
Phase 2 is when you start to get more permeability here at the...
Okay, that's okay.
Yep, and that's when now we're moving into phase 3 with that capillary permeability, protein and fluids leak out. Remember we were talking about these big
Protein.
cells that shouldn't ever be crossing here, but now all of a sudden they're getting into this space too. So what do you think that might do?
It's gonna clog everything up.
No,
I'm not
Big
allowed
stuff
to
gets in.
expand.
It wants
Yeah.
to start to collapse it
heavy.
actually.
Yeah.
So
Oh, really?
this, having these proteins move up in here is going to increase what's called the osmotic pressure. So do you guys remember like way back into like chemistry where you talk about osmosis? So
Human.
osmosis is
Osmotic
where
pressure.
fluid tends to flow from areas of low concentration to areas of high concentration.
Yeah.
So if you've got a bunch of salt over here, then the water is going to naturally be trying to like move that into that region. So that's kind of a similar concept here. You're increasing this osmotic pressure, so the proteins that are in there, the bigger cells that are in there, are going to keep attracting more and more water out of your riverbed here.
We learned that today from Tomas.
All right. Tomas is great, isn't he? Okay. So with the increase of your osmotic pressure, you got more fluid coming in here. It's going to create the first stage of pulmonary edema. Now, in your nursing assessment, you walk into a patient's room and you've got a diagnosis of pulmonary edema. What can you expect to hear when you listen to the lungs? Good. So that's your first step here, just helping you keep science and also start to look at the nursing of it. All right, now move into stage 4 here, your phase 4. Keep on going with that decreased blood flow down here, and the fluids are building up in the alveoli. It's going to start to damage it even more, and it's going to start to decrease surfactant and and it's going to decrease the like reproduction of surfactant. So not only is it kind of damaging,
So now it's
The-
not going to even expand because it's too sticky.
so it's
But is it sticky?
Because
It's
you lose the
slidey.
surfactant.
It's
The
not slidey because
It-
is
with
it
surfactant-
producing more
with surfactant, it should allow your lungs to be able to expand and
Right.
contract, stay elastic, and also for bits to slide as needed.
But there's more surfactant produced or less?
Less.
Less. That's what I thought.
Less, yep.
Okay.
And so, with that with that decreased surfactant,
Okay.
it's also going to start to encourage more alveoli to be damaged and also to start to collapse altogether. So cells are unable to produce more surfactant. The alveolar collapse. Now you got impaired gas exchange. So
That
tell
makes
me what
sense.
you think as far as impaired gas exchange. What kinds of gases do you think are?
carbon dioxide.
Carbon dioxide, oxygen, yeah, so I can't tell you exactly how, but this is where you start to get some metabolic acidosis. So I'll have to kind of look that up and get back to you on whether, like, how that's going to play into this, because this is clearly a respiratory.
Yeah, that's
but as I
what
was
I
reading the
was
book, you're like,
question.
oh, this patient's going to metabolic acidosis, and I was like, how's that happening? But anyway, so phase 5, you're starting to get into this stage where the oxygen can't get into the capillary. So oxygen's stuck up in the alveoli, it can't get into the O2 or into the blood where it's really supposed to be, right? You want it down in
transport.
your hemoglobin so it can go perfuse the rest of the body, right?
Say that one more time, just that one part. Sorry. O2 can't
Oxygen
get into the
cannot get out of the alveoli into the blood. So the blood remains unoxygenated as it passes by there. But the CO2 is getting out. I don't know. It just is.
Maybe it's a s-
That sounds like a good
Slower?
question for your master's degree.
Yeah.
Just for now,
'Cause that
accept it as
makes-
fact, and then go back and tell us
well
all.
then.
right. Figure
Will
it out.
do.
In a post conference 5 years from now,
Report back.
report back.
Will do.
So with each exhalation that this patient is doing, he is going to be losing more and more CO2. So what, alkalosis or acidosis? Are you- Alkalosis. But yet somehow it's being a metabolic acidosis. But just for now, take it as is. You're going to be losing CO2. So
Is it because more like acidosis first, then along the way as it worsens, then you get alkalosis? You don't
maybe,
remember?
yeah.
I don't know. CO2
Do you guys
Is
eat
it
Tomás?
respiratory? Is respiratory alkalosis though?
That's what I would say. The book that I was starting to pull this from, it was saying that this patient's going to a metabolic acidosis, but then based on all this stuff, I was having a hard time. But
Yeah.
just for now, just know O2 cannot get into the blood, but as you keep exhaling, you are actually getting rid of your CO2. So this
Okay.
patient is going into a.
Athletics.
Okay. The final stage is stage 6, where the pulmonary edema continues to worsen, and the inflammation leads to fibrosis of lung tissue.
So
And then you get ultimate decrease of gas exchange.
like you can't
COPD?
hardening, right? Like the lungs,
So
so you
just
can't
hard.
really like expand it.
Right.
It leads to what? I'm sorry.
Fibrosis.
Okay.
And that's not reversible?
Not that I'm aware of. So, hopefully not all the tissue would be fibrotic. But,
So you have at least some.
so anybody who's going into ARDS, you've got a very slim chance unless they've got really rapid response team that's going to be.
How long does all this happen? Like over years?
No. This is
Months?
acute. Yeah. This is in a matter of probably like a few.
So what would they do for this patient then? Like if that starts happening?
Well, they need to be getting the fluid.
Laces.
They're gonna do a paracentesis.
Art.
No?
You missed the
Are we gonna drain the fluid?
about
What are we doing?
So with pulmonary edema, you need to treat the causes. So you got to think about
Oh.
CHF. You got to
Yeah.
be so.
Okay.
Okay.
Oh, okay.
Alright.
So that's it.
right.
I just got all excited there about draining somebody's lung.
Just stick a pencil in there.
No, yeah.
So does anybody want to use the notes and try to start to explain it to Shelby?
No,
This will
but
be
I
good
did
learning.
record the whole thing.
Oh, good.